Hi, my name is Reyt Healthy, Director of Public Health for Sheffield. This is COVID Situation Report, 14th of March. Firstly, epidemiology, flat to gentle rise in Yorkshire. The testing data is not much use these days for all sorts of reasons, so increasingly we rely on the ONS community infection study. Flat to gentle rise in Yorkshire is the answer. Mixed across all age groups, and actually it's rising faster in some regions. Yorkshire is still flat, so we may have a rise to come. Last week, there were 2 million people in England who had COVID-19, so nearly 4% of the population, or 1 in 25 people. So, you know, this isn't over by a long stretch yet. Broadly, the epidemiology is benign, but with some caveats. BA1, Omicron 1 is going down everywhere. BA2, Omicron 1 is drifting up everywhere. The net result is flat-ish. No major new variants now. That may change, who knows when. Hospitalisations quite low but not zero. Some signs in some parts of the country that's beginning to go up again. What I think we'll see over spring and summer is a flat scenario, flat but high baseline scenario. I wouldn't want to be drawn what happened in autumn, but I think we'll have a further wave in autumn and we'll see what happens there. Other things of note, the Vivaldi studies, they're clearly demonstrating that for the very elderly there is waning immunity. Thus the call from Joint Committee on Vaccination to do a spring booster is very valid in my view. Broadly, high levels of immunity from either having had the virus and being vaccinated against the virus. That seems to be holding up with some caveats. Spotting the next wave will be interesting. So we'll be very reliant on the ONS Community Infection Survey and the Zoe app, but we're also shifting back to old school methods because we don't have or won't have the mass testing data. So we'll be very, very carefully looking at outbreaks, for instance. As ever, lots of polarised commentary on social media. It's interesting how the anti-vax commentators have now shifted to becoming very pro-Kremlin, which is an interesting move. This is not the cold. You see lots of stuff that this is the cold. The true mortality and morbidity from Omicron is much lower than in early phases. It's true that the COVID infection is now 40 times less likely to result in death than it was in January 21 at the height of the alpha wave before we had lots of vaccines. That may not always be the case. The next variant might not be as benign as Omicron has turned out to be. So let's not all fall into a false sense of security that this is over. It's not over. Look at what's happening in Europe. A significant uptick again. Relaxed mitigation measures is definitely having an impact. BA2 or Omicron 2 is having higher transmission and some waning of immunity. That's all in the mix all at once. We still have a high baseline rate in this country as well. So where we go next, living with COVID is not giving up. It is still harming some people, so we definitely shouldn't give up. I will continue to wear my mask. I'd encourage others to do so. Not many do. Basic public health measures are not lockdown and are not restriction. It's not over by a long stretch. We're definitely entering into a new phase. We'll remain to see what happens over spring, summer and then into autumn. So on vaccinations, Sheffield Children's Hospital are doing drop-in COVID vaccination clinic for 12 to 15-year-olds with underlying health conditions. If you work with, know or have a child aged 12 to 15 who has an underlying condition, or sometimes they're known as people who are clinically extremely vulnerable, there's a set of drop-in COVID vaccination clinics opening at the Children's Hospital. You will have been contacted previously about having a vaccine if your child is on the clinically extremely vulnerable list. If you're not sure, then there's a link to the national guidance that's available at the end of this video, and the Children's Hospital are opening a phone line to provide advice. You don't need to book, just arrive at the Children's Hospital main entrance on Clarkson Street and visit Pink Outpatients, where the team will be ready to help. This can be for the first, second, third or fourth dose. The drop-in clinics are open from 5:30 to 8 today, the 14th of March, tomorrow, the 15th of March, or this Friday coming, the 18th of March. And if you have any questions about the information, there's an email address at the end. It was National Social Prescribing Day last week, and we were able to celebrate and recognise all of the local community groups and projects who've been keeping us healthy right the way through the pandemic, but well beyond and before the pandemic as well, with support to improve fitness, well-being, mental health. From me and us, here's to all of the volunteering community sector and faith groups in Sheffield who've been keeping our residents healthy on Social Prescribing Day and every day before and since. And well done, thank you to all of those who were involved, and let's keep up that good work. Reyt Healthy Sheffield. As we start to get back to normality, we'll be moving all of our public health related content back to the Reyt Healthy Shef pages. The Sheffield Council's social media channels have clearly focused extensively on COVID information, testing, vaccination through the course of the pandemic. As we move to a different phase, we're moving it all back onto the Reyt Healthy Shef pages, and we're relaunching that, and all of the public health information, including COVID information, will be found there. So head to Twitter or Facebook and follow @Reyt Healthy Shef for more information, and that's information at the end of the video, and you can subscribe to this on the newsletter too.